project has been a pilot project exploring over a 2-year period how to start introducing concepts of mental health into Christian context, with a focus on Black-led churches. What we found is that it's been very difficult, that many people don't want to talk about mental health. They don't want to engage in the issue. They don't think it's an issue that they want their congregations to talk about. What we found is that the pastors and the ministers, some of them are gatekeeping, and it's up to them whether we get access into the churches or not. When we've actually reached the congregation, we've found that there's many of the people are really keen to talk about their emotional health. And what we've done is, over the period of the pilot, we've learned from it so that we are focusing more on mental health and going into a sort of deeper conversation where people can reflect on their own personal health within a church context, and people have opened up to an amazing extent.
When my patients are discharged, we have got people in the community whom I would want to engage with, so that they would be able to help with the stigma, so that the patient, when they are in their community, they would have some people visiting them without judging them, without putting anything wrong on them. So I go there again to try and bring down the stigma. Yes, in some areas it is difficult, because think of it, why is it that up to about the 60s people are still kept out there, Some of their mothers would, if they would resurrect today and see the mental health hospitals in the community like this, they would say, what is this? They used to be kept outside there, you see. And they were, when they said that, they were still members of the church. They were going to church, and they were keeping outside, out of sight, out of mind.
I have been delivering sessions in churches based around emotional literacy and therefore prevention of more stronger mental health issues via people talking more about their emotions. I also tying a lot biblical stories and biblical figures to show that mental health has been a topic on the Christian page for thousands of years, and that it's okay, it's not an us and them thing, it's an us thing. To give an example of a session that I may run, I would for instance do an exercise called What Would Jesus Do? Now this exercise is based around a person feeling really depressed, they're stuck in their house, they're feeling at their lowest ebb, they're feeling pretty suicidal, they don't know how they can cope with their life, and then they hear a knock on the door. It's in the middle of the night, it's raining outside, and they go to answer the door, and who's standing at the door but Jesus? And the question I would ask to a congregation is, what would Jesus say to that person, and what would Jesus do for that person? And the types of responses you get back are very interesting. Plus it pulls into the idea of Christians, once they understand how Jesus would work towards solving this problem, they have kind of more of a basis for them to help.
It will also be beneficial to church members, because instead of just listening to those gospel passages where Jesus heals someone in need, they are actually continuing that ministry of healing. They are engaged in that.
Part of what makes the sessions unique is that because it's always working within a church congregation setting, everyone knows everyone. That can also be a barrier, but what tends to happen is, because that trust is already there, the content of the sessions gives people permission to be really open about how they truly feel, and that's when we actually make movement and progress.
First of all, it was unusual and also interesting, because mental health is an area that people shy away from, and very often it's something that's never talked about. So the first unusual thing was someone who's wanting to talk about it, not as a problem, but as an opportunity, and that was new. And you were offering an opportunity, not just to say, oh, how difficult this is, but to actually embrace it and address it and inform other people of it. So that all of that put together felt like a really interesting option. And it was a great experience, I think, for the church members. And particularly striking thing was the number of people who came to church, because we had, I think promoting it was very important, letting people know it was happening in good time, because otherwise they shouldn't just stumble into it. And I was heartened by the fact that so many people did come, who I didn't see the week before or the week after, came and went away with things to think about, and said they were very moved and very provoked in terms of thinking about the issues of mental health and their own issues of mental health. I think even things like feeling down or feeling depressed are a state, the state of your well-being being a little bit eroded, and I think everyone experiences that. So
people who are still in that kind of like that pit and that darkness, people having a hope, which the Bible says we have a hope that does not fade away. Having that hope, knowing that hope is constantly there, means that we have something to attain to, whereas somebody who is hopeless is still in that dark pit. So knowing the truth, what is true, it says the truth makes you free. Knowing the truth makes you free.
Do you think that creative art and mental health work well together?
I think it's very hard sometimes to talk about how you feel, and I think with mental health issues it's particularly hard to talk about how you feel, because you feel sometimes there isn't an audience, or you can't explain it, or maybe it's an illness that actually it doesn't allow you to be so articulate. So I think being able to draw is a very personal language, and there isn't the prejudice of language and the way you express yourself in other ways. So I think it's very empowering. So big circle on a piece of yellow paper. This time, if you pass it on, we're going to do the eyes. Only the eyes, happy eyes. What you think about the shape of happy eyes, how you think they are.
I ain't got a clue about eyes.
Just draw a big happy face. If your mouth is laughing, your ears are higher. I'll come back to those shortly.